Logo CDC.
Creating a customized care plan for a child's return to activity that is tailored to their specific symptoms can help with their recovery and mitigate adverse outcomes. Let's explore the return to activity process.
An animated presentation.
For most patients, a brief period of rest, about 1 to 2 days, is recommended. But a child should not be isolated in a dark room or made to lie in bed all day. Encourage a good night's sleep, daytime naps that do not interfere with nighttime sleeping, and engaging in relaxing activities at home. Caution them to avoid any activities that pose a risk for another head or brain injury throughout their recovery, such as any activities with risk of a hard fall or collision.
Off-road vehicle, bicycle, skateboard, football.
Address parents' and caregivers' questions about medications, emphasizing safe options like ibuprofen or acetaminophen for headaches. Caution against over-reliance on these medications to prevent overuse or rebound headaches. Within 2 days, most pediatric patients can begin returning to non-sports activity that does not more than mildly exacerbate symptoms.
Yoga or meditation.
This includes light physical activities like brisk walking for 15 to 20 minutes each day. Recent research shows that early return to physical activity, especially subsymptom threshold exercise, is beneficial. Monitor mental health and social support during recovery. Emphasize that return to activity is a gradual process, and a full return to activity is dependent on the recovery progress.
Text, return to school process.
Most children can go back to school within 2 days of their injury. They may need accommodations or supports at school, like rest breaks and extra time to complete assignments.
Monitoring persistent symptoms.
Highlight the importance of monitoring children with mTBI experiencing persisting symptoms. Watch for symptoms like chronic headache, problems with memory and attention, delayed response speed, dizziness, sleep disturbances, and cognitive impairments. If symptoms do not resolve with standard care within 2 to 4 weeks, referral to specialists may be beneficial.
Return to sports progress.
Return to sports is a stepwise process. There are specific considerations around returning to sports following an mTBI, including whether the child plays a contact or non-contact sport. Creating a personalized care plan for a child's return to activity after an mTBI can help promote a successful recovery. Remember, each child is unique, and their plan should be tailored to their individual needs and progress.
Text, click the next button to continue. An arrow points to the bottom right-hand corner.